I am a board certified general surgeon. I'm a breast surgeon and a specialist of diseases of the breast here in Florida. I'm about 30 miles south of Orlando, Florida. I work for Advent Health Hospital in Davenport, Florida, and I'm happy to be on your program. Tremendously affected. That's probably, it's funny that you asked that. I haven't thought of that, but my bedside manner is kind of, through the years, one of the things that I've been able to pride myself on and learning. I'll probably retire at 80 years old and look back and go, what, my bedside manner was horrible. But I have a lot of wonderful feedback from patients on my bedside manner. And so I guess it's really, really good. But recently I've been I would operate on a lady who really needed an operation, and I'm having to call them post-operatively to check on them when normally I'm able to check on them physically and look at their incisions and go through their pathology. I'm actually calling these women after their operations, which they're all doing fantastic. They're all extremely understanding of why that's happening. Extremely courageous patients that I have, but that's very strange for me. But we've done a good job with that. And the other thing is women who need to be, we'll do breast biopsies. And normally I want my ladies with me when I discuss their pathology result. And for a lot of these women, I have to call them on the phone and discuss their pathology results with them. And that is very, very uncomfortable for a lot of women. However, I have the most amazing, courageous, optimistic patients any surgeon could ever have. And they're doing so great with this. They're happy to stay at home. And they're happy to talk to me on the phone. They know I care. They know that I'm going to develop a great treatment plan for them. But it is strange. I can't hold someone's hand when I tell them they have cancer. I can't hug them, as I'm very careful with that kind of thing in these days. But I'm a hugger. I'm from Texas, and a lot of my ladies, with their husbands, sometimes I'll just hug them and I'll hug their husbands and tell them I'm going to take care of them. So those things have changed. I have seen through this. I deal with a very strong group of patients, a strong group of women, some of the most amazing women you've ever met who have or had breast cancer. And they are doing so great with this. And they're such an inspiration to the rest of us who are really being affected by this virus. I mean, these women have gone through things that you and I may never go through. And they're strong and they're courageous and they're willing to do what the doctor orders for the first time. Many of them they're staying away and they're happy to stay away. But a lot of things have changed as far as the way that I'm practicing medicine. But we're doing a very good job at it. It's still as thorough, still as thought as caring as it always was. But I'm very encouraged to see some of my ladies who. Before this virus, some of these ladies were told the worst news that any human could ever hear. And through this virus, they are protecting themselves. They're protecting their families. They become this machine of they're doing the right thing, and it's just amazing to watch them evolve from a history of breast cancer into this extremely loving and caring individual who sees the world in a different way. I've enjoyed seeing that evolution in some of my patients, most of them actually. Through this process.